One of Georgia's largest health systems is reducing its workforce, announcing plans to lay off about 2% of its employees. Now, Wellstar says that these cuts do not include frontline healthcare workers, but the move is raising questions about what it could mean for patients, for employees, and quite frankly, about the future of healthcare in our region. So who better to talk to this morning than Dr. Jay Heiman, a clinical professor of health policy at Georgia State University School of Public Health. It's great to have you this morning, sir. Thank you for your time.
Thank you. Appreciate it.
When you first heard about Wellstar's layoffs, what went through your mind from a public health perspective?
I mean, from a public health perspective, I guess two things. You know, every business has to ensure that their operations are both effective and that they are efficient and meet their financial needs. When Wellstar said 2% and they said it wasn't going to affect frontline workers, I worry a little bit about who is affected because every frontline worker, every physician and nurse relies on administrative staff and support staff to do their job. And I also, it's a large hospital system. We really don't know where across their system it's being impacted. And the other thing I feel obligated to say is that Wellstar as a health system has demonstrated in the past that sometimes their financial bottom line takes priority over their mission to serve the community. If we look back to 2022, when they abruptly closed both Atlanta Medical Center Midtown and Atlanta Medical Center South, they really abandoned those communities in ways that we're still struggling to put back in place. So all of those things give me concern.
Point to that historical context. Is this the kind of pressure that is unique to Wellstar, or could we see other healthcare organizations in the coming months and years also be having to make tough decisions like this?
Yeah, I think that's a really important question. The question of, well, what are the other factors going on more broadly that might be leading to this? And I think that the most critical thing for consumers and potential patients to understand is that Congress passed legislation a year ago, H.R. 1, which dramatically reduced opportunities for affordable health insurance to consumers. In the H.R. 1, two things happened. One, we didn't continue enhanced premium tax credits, which allowed in Georgia about 750,000 low-income working people to get private insurance policies. As a result of the policy change a year ago, already we've seen over 500,000 Georgians lose their coverage. When I say lose their coverage, I'm meaning for the most part, it was no longer affordable. The other thing happening starting January 1st is that there are dramatic cuts to the Medicaid program. So Georgians currently covered by Medicaid may find their coverage more limited. For hospitals, this means they're going to be seeing many more uninsured patients, which again to them is a direct hit to their financial bottom line. So I wouldn't be surprised if we would see other hospital systems making similar kinds of actions. Estimates are that hospitals overall might see between a $1.5 and $4.5 billion revenue loss as a result of these changes. And I think the last thing I want to say is that these are cuts to critical health programs that were put in place to fund a tax cut. And I think that's really challenging for those of us in public health who are concerned about people having access to the critical health care they need.
Well, let me ask you about the folks who do need that access. They do need that care. If they're a Wellstar patient, are they going to be impacted by these layoffs at all? I mean, Wellstar says it's 761 employees, or about 2% of our more than 35,000 employees, and it does not impact the frontline workers. But if you're a patient, could you still feel the impact at all, you think?
So, as you know, I'm a public health professor, but prior to my career in public health, I spent 20 years as a family physician working in Marietta, so in Wellstar's backyard. And I can tell you, as a physician and someone who has practiced medicine both in a private clinic and in a hospital setting, we rely on critical support staff. If you're trying to get an appointment with a doctor, and there are fewer people to pick up the phone to schedule the appointment, if you need tests scheduled, if you need to arrange for follow-up with patients, those are all things that require support staff. So again, I don't have any insider information about who's being laid off and where they are across the system, whether there's unnecessary overlap of staffing, but based on the experience of most of the people that I know who already have trouble getting in to see a doctor, getting timely follow-up, getting timely tests and procedures ordered, I would worry very much that people are going to feel a difference.
What about from the perspective of being a former physician? How could these layoffs impact your day-to-day work?
Well, again, physicians in practice turn to their staff to provide critical functions for them. So if I have patients that I was concerned about, I would rely on my staff to follow up with them by phone. I would rely on them to schedule appointments with specialists or appointments for X-rays or other diagnostic studies. So again, if we're cutting out that layer of supportive staff, it could have an impact on the patient experience and quality of care.
You know, Georgia, as you know, continues to experience just rapid population growth. How do you think these health systems should balance trying to improve efficiencies with also still providing, the best care possible to their community?
Well, I think that's a especially important question for hospitals like the Wellstar system. The Wellstar system, I commented about their community mission. They get a tax break, right? They're a not-for-profit hospital, and the expectation is that they give back a critical service to the community. And I think that's where the state really has a role to keep hospitals accountable to that community mission, and make sure that we get a bang for our buck. When I say a bang for our buck, the taxes they're not paying at the state level, we should see back in community service. And that's where I think, in particular, it concerns me that the Wellstar system closed critical hospitals that were needed in both Midtown and South Atlanta. So I would really like to see the state step up and take a much more active role in assuring that these not-for-profit hospitals actually balance it out in a way that prioritizes patient needs, access to care, and quality of care.
Dr. Heiman, it's great having you on the show, and we appreciate some important context and perspective from you this morning. Please come back anytime.
Thank you very much.